Good morning, Dr. Karthik from the Metromale clinic, andrologist, urologist, and sexologist. I want to talk to you today about psychogenic erectile dysfunction. Now, in my previous video about sexual dysfunction causing infertility, I just did broach the topic about what ED could be and what are the types of ED that I encounter in my practice. Now, what is psychogenic erectile dysfunction? Now, you have to understand that male ego depends predominantly on two things. Okay, so the first thing is how much money they can make, and the second thing is how good they are in bed. So you have to understand that men are acutely aware about their performance in bed. Now, oftentimes it happens because men have not had prior experience in sex before getting married. On the day of the nuptials, what happens is both the man and the woman are at a loss as to what to do. Sometimes they could probably watch a video or read some books, but they are completely at a loss. So both of them end up trying something, an attempt at intercourse, and sometimes it may not be successful. Now, it may not be successful because the woman had pain, or the man was trying to thrust against a tight vagina, or he was very tired after the marriage, and so on and so forth. Now, the first time it's all right, but the second time he tries to do it, he again attempts it, and like I said, again, if the vagina is tight, he is going to push against a closed opening, and he might lose his erection. Now that he had had a negative response in the last two times that he really tried to have sex, he is constantly thinking, this is playing on his mind. Can I have sex? Will I be able to sustain my erection? Will I be able to penetrate? Will I give her pleasure? And would this end in an ejaculation? And last but not the least, he might even have pregnancy on his mind. So with so many things playing on his mind, he is not open to stimulation. Now you have to understand the most important thing that is responsible for an erection to occur is stimulation. So he has to be open to stimulation. Now what happens when he is not aware of this, when he is acutely aware of his own penis and he's thinking about himself, he is not open to the stimulation that is coming from his wife. So his wife may be lying nude on the bed, but still he's not looking at her. He's just looking at himself, he's looking at his penis, and he's looking about all his prior past failures. So what happens? He goes into the fight mode. And when that mode happens, the hormone called adrenaline comes in, or the neurotransmitter called adrenaline comes in. And what adrenaline does is, it takes all the blood from the penis and takes it to the brain and the heart. So the penis loses the erection. Now this man could be normal when he is actually masturbating. And that is actually telling you he does not have an organic problem. But when he comes into the bed, his mind is not there, he's constantly anxious, and adrenaline gets in, and hence he develops psychogenic erectile dysfunction. Now the treatment for this is not a sildenafil citrate tablet or a PDE5 inhibitor, because that works only in an organic cause. The treatment for this is going to be psychosexual therapy. I will talk to you about this in another episode, but hope you understand what psychogenic ED is. Thanks for watching and subscribe to our channel.